Hi, everyone. Welcome and thank you for joining us for another one of our live video chats here today. As usual, we'll have Q&A open from the beginning. So if you've got questions, feel free to hop in there and ask them. We'll be taking them throughout. I'm joined once again by Justin Granert, our VP of Public Policy. Thanks for being here, Justin.
Of course, thanks for having me, as always.
And we are both joined today by Representative Robin Smith. Welcome, Representative.
Thank you guys for the invitation.
Thank you for being here. And thank you for coming and sharing your thoughts with us on sort of Tennessee Pledge, our economy, and sort of where we are in Tennessee.
Well, I appreciate the invitation, and I want to start with the remarks kind of plainly by telling everybody thank you. We are here in my office in Nashville. We returned in the House this week, and we are following the lead of Tennesseans. You are showing us that we can keep the case count down, and we haven't exceeded our healthcare resources. That was the goal. We've done that very well by embracing social distancing, face coverings where they're appropriate, good hygiene. One of the things too that now that we have learned how to navigate these waters, and there have been a lot of great sacrifices, and I admire many of you as men and women of business that have pulled together, taken care of your employees, and done your best to survive this horrible pandemic. But in the meantime, we're setting the stage for a great comeback, and I'm going to be very optimistic that that's something that we are within reach to do. But we're following the Tennesseans' lead by embracing the Tennessee Pledge, opening our doors back. I've already had meetings here in my office doing the people's business, and it's a very important time. I know that while we're here over the next couple of weeks, the primary goal is to address the budget. There's going to be potentially, and again, I would rather Senator Bo Watson, who's chairman of the Senate Finance Committee, or vice chairman of the House Finance Committee, Patsy Hazelwood, acknowledge this, but we're expecting around a $500 million shortfall to our state's budget for this calendar year, and we're looking at up to $1 billion shortfall for 2021. And so it's not a pleasant time, but just as you, as in your businesses, have made cuts, you've made tough decisions, Tennesseans are going to see the state legislature do the same thing working with our governor. And we're one of the things that we've got to be careful to do is to make sure that where we appropriate these funds, it's not to grow government. We are in a very narrow window, and we've learned a big lesson watching the federal unemployment insurance come down with that supplemental $600 per week. That money changes behavior. And I know that some of you are expressing concerns with our office and other offices that you're having problems getting people to go back to work. And so while we don't want to take government spending and make it to compete with private sector activity and make sure that we don't get in your way. So there's some key things that we're going to be doing, but there's over $2 billion that's going to be coming to the state of Tennessee to be appropriated through different projects. And some of those will be heard within the executive branch, some in the legislative branch, and you'll be hearing more and more detail about that coming from our Senate Finance and our House Finance committees and our leadership. But in the meantime, I think that the most important thing that we can do is continue to embrace the Tennessee Pledge, work toward demonstrating consumer confidence. And one of the things that I would just tell you is we can't keep moving the goalposts. We've got to be firm in what we tell you, because just like the stock market will respond to bad news if they know there's an end in sight. And even though this virus is very unpredictable in a sense, because there are some case counts that are going up, what I would tell you is there are things that we've gone through worse before. We just haven't had social media and some of the 24-hour news cycles to broadcast it. But we are going to see Tennessee come back, and I believe that we're going to be following your lead. And I expressed to Justin and Jeremy before the call began, I'd rather spend time answering your questions, but expect some key bills that are coming out of the House and the Senate this week and the next couple of weeks about the budget, but also the fact that we're going to be looking at some healthcare reforms during the emergency orders. There were a lot of things that had to be pulled out of the way to accommodate patients and this new COVID a way of treating folks in healthcare. I think a telemedicine bill is going to be forthcoming. Surprise or balanced billing is going to be addressed in some capacity. Certificates of need, which is a very regulatory heavy piece of legislation. And then there's some other bills to address literacy, as well as some judicial reform. So we're going to be doing some going back to business that impacts our state. But just understand that while our priority now is to make sure that we balance this budget and do it in a way that we're not just funding governments, but we're also getting money into the hands of Tennesseans so that you can we can follow your lead rather than funding governments. So at this time, Jeremy and Justin, I'll be happy to pause and take some questions.
Sure. I mean, obviously, it's sort of been a different time than it was on March the 19th when we gavelled out for this recess. What do you think? How do you think the process is going to look, similar or different, if people are coming up to Nashville, sort of in the wake of this pandemic and the effectiveness of legislators doing their jobs, sort of post pandemic?
Yeah, well, right now, the public is welcome to the Tennessee House. You'll be greeted at the front door where that you typically go through for security. You'll have your temperature checked. You'll be asked if you've been tested, experienced any symptoms of the COVID virus, taking care of someone that has been positive. If you've been quarantined, you'll be asked a series of questions. And then in common places, you'll be asked to wear a mask. That's what we're doing on the House floor. Up here in the Cordell Hall, we're wearing our mask. In the common places in the office, we're not. And I think it's working very well. In the committee rooms, you'll see that leadership has erected plexiglass between members on the rostrum, and so that we're able to conduct the business and interact with the public, and the public will be allowed in the committee rooms. And again, I think that we will have to accommodate some of this time, but we're making a very concerted effort to make sure that the House is open to the public while we're making spending decisions and we're allocating money. It's very important for you all to be able to see what we're doing and interact in some kind of way, particularly if it relates to a specific bill or policy. How this looks going forward, there's no way to know. People ask, do you think this is going to be something that is a seasonal type virus? It very well could be. It very well could mutate. The horrible thing about viruses, because they work with RNA and transcriptionase, and those are big old biology words, but the reality is this virus will not look the same most likely as it is now in about 6 months. It will find a way to mutate. That's why it's so very hard to create vaccines for viruses. Years ago when I worked in intensive care space, I would get pulled into parts of the hospital and I took care of HIV/AIDS patients. And that was in the late 80s and early 90s, and there's still not a vaccine for HIV. We have learned to take care, prevent, accommodate that, and treat patients. And this may be something very similar. But again, I think that I'm going to be optimistic. We have kept this case curve down and not exceeded our health care resources. And so I just think it's part of our life. We just need to be very aware. Funny enough, it's either Bloomberg or Forbes this week published an article about Japan and how there is a culture that's very commonly wearing facial coverings, and they didn't close down their economy. Instead, they protected the most vulnerable, and they isolated and quarantined those that were positive. And I think that there's ways that we can do this again as we see potentials for other case count spikes.
So thank you for that. Obviously, one of your bills that you were carrying is the telehealth bill. And that was sort of obviously pre-pandemic, but it sort of became a real reality sort of in this situation. Talk a little bit about the background of that and what you see the legislature doing now going forward as we sort of address sort of this type of access to healthcare.
Yeah, I'm pleased to tell you that on March the 19th at 11 p.m. Central Time, when we were, the last House bill before the budget that passed was the telemedicine bill on the House side. And essentially what that does is currently in state law, the telehealth is treated as a facility-to-facility transaction. A patient, to have this covered by insurance, a patient has to be at a doctor's office or a hospital talking to another doctor's office or a hospital. And what the bill that I'm carrying would do, and it's sponsored by 79 other co-sponsors in the House, it was unanimously passed on the 19th of March. It essentially allows a patient to be at their home, their place of work, school, anywhere that's appropriate. If you're a truck driver, this is you will be able to interact with your own doctor. And it also allows a patient to be reimbursed with their own doctor, not have to rely on a proprietary tool. It's been wonderful. We've got some insurance companies that have a internal proprietary product, but you're interacting with providers that may or may not be in your state. When you call, you get a different provider every time. And what this bill does is it allows existing Tennessee doctors, nurses, nurse practitioners, PAs to be able to treat their existing patient population with telehealth and telemedicine and have insurance companies pay for it. And really the difference that we have in the two chambers, the Senate passed a version, it was a little bit different, whereas and I'll give you a perfect example. Many of us have been forced to telecommute and telework during this COVID virus, but I would dare say that our teachers have not had their salaries cut. None of us, if you've been asked, your income should have stayed about the same. And what's in current law in the Senate version that's different from the House version, it would not establish payment parity. And the House version just simply says, if you're able to conduct and deliver the same amount of health care in the same type, and you're able to code and chart it at the same level as an in-person encounter, it should be paid for identically. So it's called payment parity. And I think that we've had this wonderful pilot project of the COVID pandemic, and we see now that it works. One thing I would tell you is, in talking with some rural hospital leadership, I'm excited to hear them say that they're going to use telemedicine once this bill passes to make sure to protect their elective procedures. And what I mean by that is, we've witnessed that, if someone comes into a hospital and they are COVID positive, and you have to do contact tracing, you have to go backwards, you have to do a lot of decontamination, and there's a desire to create a portal to treat COVID symptoms and bring them in to their institutions and facilities in a different pathway to allow all the elected procedures to continue uninterrupted and the ER to remain what it is, and for heart disease, for traumas. And so I'm very excited that we're going to get to a good place and hopefully have that as a law very soon.
So speaking of that, we have a question that came in talking about sort of various hotspots in our area. Mm-hmm. One, sort of, as these numbers have gone up, what is sort of behind that, as far as you can tell, and kind of why are we seeing sort of spikes in our region?
Well, and I will say it's not just our region. I think that what we're seeing is people are either embracing the Tennessee Pledge or they're not. And one of the things that we have to just know with certainty, that COVID or coronavirus is transmitted by person-to-person contact in the exchange primarily of vapor respiratory droplets. And where we're finding the sudden burst of cases are the result of two things. Number one, there's more testing. And you can follow me on social media at my Facebook page. You can also follow me on Twitter. And there's some graphs that I pulled together from Politico as a great source. And it shows that Tennessee is in the top 10 to 15 in the United States on testing. I think we have surpassed over 400,000 patients that have been tested. And our positive rate is around 5%. It's very low. And so the testing has gone up in certain areas, particularly. And in these certain areas, one of the things that, and this has been in several media accounts there in Chattanooga, as well as Becky Barnes, the administrator of the Hamilton County Health Department, has said this, that in this one particular zip code, there are multi-generational homes or multi-family homes where you've got people that are living in a very concentrated, very condensed space. And back to that article that I read, and I wish I could remember if it was Forbes or Bloomberg, in Japan, their guidance is to avoid closed-in spaces, to avoid close contact, and to avoid spaces that are too crowded. And so when you think about how this virus transmits, if you're living arrangements or in overly tight quarters and you are out and about, most likely you're going to increase the likelihood of exposure to this virus. And unfortunately, that's what's happening. And so you're seeing this very concentrated, cases that are going up. But the good news is, while we have had some increases in hospitalizations, again, it's not been terribly high. One patient is one patient too many. But I would tell you that, in 2017, there were over 70,000 deaths due to the opioid crisis. And yet how we responded as a culture was we determined that there was a problem. We knew that we had to have a united front and intervene, but we didn't shut our economy down. And so what I would say is COVID is something that can kill the elderly and the disproportionately weak and frail. But what we're finding is, we don't want anyone to be sick, but it's also something that I think is going to be with us for a while. And I think that I just applaud the fact that Tennessee Businesses has led the way and shown us kind of how to get through this.
Speaking of sort of Tennessee businesses, as we start to reopen, liability issues are something that are of utmost concern for our members. I know there's been some talk at the federal level of doing some temporary reforms based on COVID-19. What's going on at the state level? What do you see the options being, and how important might that be to get done?
Well, I will tell you what disgusts me is to see social media ads as well as TV ads talking, encouraging people to contact a certain, group because, if you feel like you're working in an unsafe environment, and truly advertising lawsuits. And what I would say is that here we have already had, I've been in no fewer than 5 Zoom meetings and conference calls. I was in a meeting this morning with some folks, some advocates. There will be liability protection legislation that both chambers are working on right now. I do think that the intent there is to not permit egregious malpractice. It's not to protect bad actors, but it's also to protect businesses that are doing your dead level best to come back and to resume activity and to make sure that you, as long as you are really doing a good faith effort to provide a safe work environment and you're following the Tennessee Pledge, it's almost impossible to determine how someone catches this. One of the things that I have witnessed that's troubled me a little bit in our local media is to see names of companies cited in headlines as having so many cases here and so many cases there, and when in fact it's very unlikely that the spread of this disease is coming from those institutions or those places of business. And so there is a very real need for liability reform, and the type of protections that I expect is to establish that some type of if you're showing a good faith effort, if you're putting forward certain parameters to meet the public health dimensions of this that have been put forward with our Department of Health and this Tennessee Pledge, I do think that there's going to be, I wouldn't call it a certification, but there's going to be some type of an umbrella shelter that's going to be encouraged. And I would just say again, I applaud every person that has navigated these waters because it's very difficult and it's very unfortunate too to see predatory type litigation that's kind of waiting in the wings, but we know that's coming and we want to do our part. I can tell you that I would expect a bill would be put forward, I would say within the next couple of days. We'll begin hearing about specific details.
Great. You're the chair of the insurance committee, you're on the health committee. What are some of the topics, maybe outside of telehealth, that you expect as either chair or as a member of the health committee? What might you guys be looking at sort of as you gear up for this next couple week run of session?
Well, in the emergency executive orders that have come forward from Governor Lee, many of those have had to remove some barriers to expanding bed counts, to do some things that are in a regulatory fashion. And there's a bill that addresses certificate of need reform. I think that this pandemic has exposed some weaknesses in our health environment. And I think that there's going to be some reforms looking at that to encourage more transparency, more competition. And candidly, there's a particular bill that, again, that I look forward to seeing is the direct medical contracting bill, which will allow patients that, let's say that you've got a very robust HSA, a health savings account, and you have a high deductible insurance policy, but you want to go get some wellness, some just maintenance blood pressure check, or you've got a small surgery. This will allow you to enter into a direct medical contract with a doctor and pay that doctor directly out of your health savings account and not have it as an insurance claim. And those are the types of innovations that we're trying to look at here in Tennessee. And these are particularly important in a time where maybe someone has lost their job and they're without health insurance. If we can find a way to give them through a new tool to access doctors' care and do it on a per service exchange or even like a subscription. Let's say that you want to go to a dermatologist or a pediatric, let's say pediatrician so many times a month with your child. There may be a way to be able to enter into an agreement for so many visits for a set fee. And we're looking at innovative ways to serve Tennesseans to make sure that you have access to health outside of just insurance. So I think that those are probably the big things in the space of health. I do know that balance billing, as I had mentioned earlier, where people are caught by surprise on a lingering bill that they didn't know that they had, that's going to be a topic. But the key thing too is to just continue to look at the fact that I do think that this virus will be seasonal for a little while, and we need to have some built-in health measures. And the thing that I talked with our speaker yesterday, Speaker Cameron Sexton, what this pandemic has also taught us is the value of health. The people that are disproportionately harmed by this are those that have diabetes, comorbidities, heart conditions, kidney conditions. I think that we need to begin talking and having a very strong conversation about our behavior and making sure that, the best way to treat your diabetes up to a certain point is activity and good behavioral choices. And so right now, so much of our entire health system is devoted to managing decline and managing disease, and that's necessary. But I would argue at times like this, we're seeing the rewards of people who have been boosting their immunity and being healthy. And I think there's a good conversation to have too on some policy.
Representative Smith, you've mentioned the Tennessee Pledge a few times. Just in case any of our viewers aren't familiar, could you give us just sort of a high-level overview of what that is?
Well, I will tell you, you need to go to the tn.gov website and get, because it depends on where you are and what your line of business is. But the most essential Tennessee pledge that I can tell you right now is, practice that physical distancing of about 6 feet when you're in a public space. If it's appropriate, and just out of respect for others, wear a face covering of some sort, and practice good hygiene. If you can do those three things and avoid just terribly close contact, I think it's good. And I hear a lot of folks that argue, well, I'm not going to wear a face mask because of my rights. Well, we went to our church service for the first time this past week, and there was a lovely couple that sat 2 rows in front of us. They seated us every other row, and a lovely couple in their mid-70s sat 2 rows ahead of us. And just out of respect, I kept my mask on. I didn't have to. I kept it on. Why? Because they are in that at-risk population. And I don't think I'm positive. I have not tested positive. I don't have any symptoms, but I may be one of those asymptomatic carriers that's, rather healthy. And I would never want to inadvertently, transmit a contagion to someone else, even inadvertently. And so, you think about a child wearing a diaper. Why does a child wear a diaper? It doesn't stop them from urinating. It just holds it, right? And why do we use an umbrella? All day here in Nashville, it's been raining. The reason you use an umbrella is to repel the rain away. It doesn't remove the moisture. And the same thing with the mask. The way to transmit this is through, respiratory droplets. And this is just a way to contain that. And I think it's just a smart way to avoid, unnecessary contact. And so I respect anyone's rights and wishes. I just think that mutual respect goes a long way. One thing I did fail to articulate earlier when we were talking about important bills, and this was, as I'm sitting here at my desk, I'm getting stuff handed to me. The right to work constitutional amendment will be indeed put on calendar. And what does that mean? It just basically will be part of our Tennessee Constitution once this amendment passes, that says that a person's employment neither depends on or is penalized by a union membership. And so, people are saying, "Oh, Robin, you're anti-union." No, in reality, this will just simply neither make it compulsory or mandatory to be in a union shop, or harm someone if they choose to be. And so we're looking forward to that particular resolution passed the Senate, and now I've learned that it will be going to the House floor sometime most likely next week.
Okay, this has been very useful, very enlightening, I think, for a lot of our members. Is there anything else that either of you wanted to cover before we wrap things up?
I'll defer to our guest.
Well, again, I can't, I know that it sounds very trite, and I know it's probably very inadequate, but so many of you have really gone through a lot with your business. I know I'm a small business owner, and it has been one of the most trying times to have optimism. But one of the things I love about America, and particularly Tennessee's slogan is America at its best. And I am watching right now a lot of heroes that will never be recognized. You'll never have your name called. You'll never have a meme with a cool superhero cape, but you've sacrificed mightily, and you've provided for your business. You've set a terrific example for your family. And I look forward to, in years past, being able to reflect back to, this crazy time in 2020, knowing what we've overcome and lived through and pressed through. But I'm just very proud, too, to be a member of this Tennessee House to represent you all back home and know that we're following your lead and we're going to get this business done. But thank you so much for the invitation.
Thank you so much for being here.
Thanks again, and good luck with the rest of the session. We'll be available to help any way we can.
Thank you. And if I might, let me give out my email in case somebody, if you are still struggling with unemployment claims, if you're still struggling with some sort of an issue with the Department of Labor, by all means, or whether you're in district or out of district, we're helping folks. It's rep.robin, ROBIN.Smith, SMITH at capital, CAPITOL.TN.gov. Happy to help and shepherd any of those complaints or claims in. But thank you all again.
Thank you.